go ahead and get started because I know that we want to use all of our time tonight. We come with lots of questions, especially on this topic in this time of year. I want to introduce myself. My name is Sierra Bragan, and I'm the owner and founder of Miami Mom Collective. And Miami Mom Collective is Miami's premier parenting resource. We have a website as well as we're active on all the social media channels, and we just want to be a resource for moms and families. So we host events. We've got a great Cookies with Santa event coming up, and then we do events just especially for moms because we believe that motherhood is hard, but it doesn't have to be lonely. And so we want to be a community for you. So if you're a mama out there, if we can serve you or your families, we're happy to do that. And one of the ways that has been such a blessing just personally for me is partnering with UHealth Jackson Children's Care for these webinars. So again, I want to say we're at least a year and a half into this, and it's just been an incredible resource. We again cover all sorts of topics. So check out the archives. You can view that anytime at jacksonevents.org. We've got everything from holiday safety to travel to all the COVID topics, vaccines, helping our children develop emotionally, dealing with children who have autism. So all sorts of topics there for you at jacksonevents.org. And I also want to let you know, if you may not be aware, that the pediatric emergency rooms at Holtz Children's Hospital, as well as Jackson North and Jackson West, are available 24/7. So 24 hours a day, they are available to you. I hope you never need them, but if you do, I want you to know that they are all staffed with board certified pediatric emergency medicine specialists. So kids and parents are getting access to every pediatric subspecialist at Holtz Children's Hospital and the University of Miami Health System and the Jackson Health System. So just some information for you there, and just a huge thank you again to Jackson for hosting us tonight. If you have been with us before, Dr. Brandon Chittani needs no introduction. He is surely a household name here. I've never actually met him in person, but Dr. Chittani, I feel like we've spent at least a dozen, maybe half a dozen times on these webinars covering different topics. And so personally, I'm very excited tonight because I know that you are a wealth of information. So thank you again for joining us. I'd love to tell our audience a little bit about you. Dr. Chittani is an assistant professor of clinical pediatrics at the University of Miami, the Miller School of Medicine in the Division of Pediatric Infectious Diseases. So this whole pandemic is really his sweet spot. Again, he has been on many episodes with us dealing with COVID, with the MISC in children. So you can go back and listen to those. He is also the associate program director for the Pediatric Infectious Disease Fellowship Training Program at UM. And he's a published researcher with ongoing projects about COVID-19, viral infections, and pediatric transplant recipients. What I love about him is that it's not just medicine for him, that it goes beyond. He has a reach in the community, ways that he has involved himself in support and advocacy for youth. And we're just so grateful and thankful to have you here tonight. So thank you so much for joining us.
Thank you for having me. It's always a pleasure.
Oh, well, like I said, you truly are a wealth of information. I want those who are listening in to know, if you have a question at any time tonight, we have loads of questions that we're going to ask Dr. Chittani, but if you have something specific, you can use that Q&A feature at the bottom of your screen. Just click that, type your question. We will do our best to get to all of those. Sometimes we get bombarded and we can't get them all, but we will do our very best. So, sometimes it's hard. We can't necessarily speak to like specific, medical diagnosis. He's not going to diagnose anyone over the phone here. But if you have a question, drop that there and we will do our best to cover them. So thank you again. And let's get started. Okay, I want to talk about what are common respiratory infections in children.
Yes, so common respiratory infections in children, doctors will put it into a few different buckets. So I'm going to give you 4 different buckets that we kind of think of. One set of buckets is whether or not this is talking about the lungs. So we have 2 sets of lungs here in our chest, and that is the lower respiratory tract. Or is it involving the upper respiratory tract, like our nose, our sinuses, or our throat? For children, most often what's involved first, what moms will see first coming out of their kids, is from their nose and upper respiratory tract, right? And then it may take some time, if it ever does, go into the lower respiratory tract. The other set of buckets that are really important to understand in having this conversation is whether we're talking about bacteria those germs that live on surfaces that can cause very serious infections, or viruses that we treat entirely different, also germs that live on surfaces, but live in a very different way than how bacteria live. Because they live in different ways, we treat them differently, and we'll kind of get into that today with whatever questions you guys have.
That's good. I know when I go to the pediatrician and they check them all out and then they're like, it's viral, and you think, okay, I know what that means. That means you can't give me something that will fix it right away necessarily. So we'll dive more into that. But also, I'm a little embarrassed to say I'm a mom of 3, but never really understood upper respiratory versus like lower respiratory, but that makes perfect sense now. So we've been dealing with green nose with my 3 children the last 2 weeks. So I know this well, and I'm sure that who are listening and do as well. Talk to us like why, or how about, are respiratory infections always as scary as they sound? Because I think I hear RSV and I just think my kid's going to the hospital. Like, are they as scary as they sound?
So there are some that certainly are very scary, and we should be aware of what those are. And luckily, though, in this day and age, many of those very scary ones we can prevent. We can prevent either through vaccinations or just keeping ourselves safe. I think COVID has taught us many different things. And one of those things is about distancing, wearing masks, keeping hands clean. All of those work for all of the viruses that we can come in contact with and can cause serious infections. Now, certainly if we're talking about little babies, children less than 12 months old, less than a year old, then these infections are much more serious because they don't have the ability to fight them the same way that older children might be able to. Older children are more likely to have viruses that they're able to combat easily, and less likely to have bacterial infections that really require additional services.
Mm-hmm. That's good. That's good. Yeah. I just feel like, especially this time of year, you hear so much about this and it's like, oh, you kind of just want to shelter down and think, I don't want anyone to get anything. But what about, do other infections, can they turn into respiratory infections? And if so, is it avoidable?
So some infections can become other infections, and that can be kind of complicated, where a viral infection can be what you start with, where you have a low fever, some feeling run down, the green nose even sometimes, and then that can progress or lower defenses to allow a bacterial infection to come in on top of that. When that happens, what typically happens is that we'll see a child start having that viral illness, not feeling well, and then 3-4 days in, they just seem worse than how they started. And they'll have high fevers, and they'll probably locate where that bacterial infection is. So whether it's in their sinuses, in their ears, or in their lower respiratory tract. So location will become apparent, high-grade fever, and it's really, really after the 4-day mark. Usually a 4-day mark is when you have the worst symptoms of a viral infection. And if you're going to have a superimpose the bacterial infection on top of it, it comes later after that.
Okay. Wow. That's a good thing to know. I feel like when the pediatrician always asks, so when did the symptoms start? And I think,
Yes,
oh, count the
timing
days.
is everything.
Important. That's so
Absolutely
important.
everything.
Awesome. Good to know. So can these infections leave lasting damage on our children's lungs?
So the short answer is no. Most of these infections are not going to cause permanent damage. In this day and age, if you seek medical care when you need to, you'll see that you're able to mitigate any and all damage that possibly can happen. When we're talking about lung infections, it really takes a lot to cause permanent damage there. The lungs are very pliable, very regenerative, and able to handle those insults as compared to other places in the body.
That's good news. Man, it's amazing how our bodies were created to just, it's amazing. Okay, talk to us about how these infections can manifest in children. And you said a little bit about high fever, but coughing, green nose. How do are certain ones manifest in different ways, obviously?
Yes. So when we talk about common respiratory infections for viruses, the most common trio of viruses that we'll talk about are like RSV, influenza, and adenovirus. Those 3 make their rounds in daycares every day. And if you live here in Florida, I have some unfortunate news that the RSV season is longer than anywhere else in the country.
Wow.
RSV season starts earlier and lasts longer in Florida as compared to anywhere else.
Is there a
In the
reason for
United
that?
States. It's because of our wonderful climates,
Okay,
and that
there you go.
yeah, RSV loves warm temperatures
Interesting.
to a
Okay.
degree,
Okay.
to a certain degree. So it likes that temperate where, it's not necessary. In the summertime, you're not going to see it so much when it's blaring heat. But
Right.
as temperatures start cooling down and as they stay cool and it's really nice to go outside, that's when
Uh-huh.
RSV is really out there
Started with
and ready to get you. Yes. And actually, I like to tie that into the type of infection RSV causes. So
Mhm.
RSV primarily, because it doesn't really like the hot temperatures, it doesn't go very deep within the lower respiratory tract. And the reason is
Okay.
the lower down that you get inside the body, the hotter it is, right? That's your core temperature
Interesting. Yeah.
that's held in the
Yeah.
middle of your body. So RSV really loves the upper airway in young children, causing lots of runny nose, sore throats because that postnasal drip is just dripping back there, cough because of the postnasal drip. That's
Right.
happening as well. You'll see the cough is worse usually as they lay down. So as they lay down and that nose goes back, and then all
At
of the
night.
flood
Yeah.
goes back there as well. And you're going to feel like you want to cough it up. It's a little different in babies though. In
Mhm.
babies, RSV can be much more serious, and that's why it's so
Right,
scary.
right.
Where
Yeah.
RSV can, for whatever reason, in young infants, trigger for them to stop breathing. Now,
Mm.
infants, I know some parents out there have already experienced where their infant was upset and they stopped breathing because
Mhm.
infants may hold their breath just because they're upset.
Right.
That is not dangerous. It's when they start holding their breath for longer periods of time
Mm.
and are not
Mhm.
breathing regularly that you would really want to
Mhm.
seek medical care very quickly because that may be
Yeah.
related to RSV.
Yeah. Are there, and I'm deviating a little bit, but on this, um, I had well, he's older now, but I think he was probably 6 to 8 months when we had a bout with RSV. And then my niece, who was 6 months older, so she was just about under a year, right at a year, she also had a bout. We kind of think they might have gotten it from each other, honestly. But
Very likely.
one had a way worse go with it, ended up spending some time overnight in the ER on some breathing treatments. Are there certain things that could cause it to be worse in, well, I mean, everybody obviously is different, but are there things to do to help prevent it getting worse?
It's a little tough from
Or
helping it from getting worse because the things that might make it worse are kind of out of our control. So one of them is the younger
yeah.
children will have it worse. If they're less than 6 months, actually, it can be really bad where they may end up in the ICU. If
Mm,
they have asthma, if you have family history of asthma or your
mhm.
child has already been diagnosed with asthma, that also might make it worse. Now, certainly controlling your child's asthma may help prevent some of those bad symptoms that could come about with this virus. But again, it's only so much that we're able to control when this type of infection occurs. What's even worse is that there's no vaccine against this particular virus.
Yeah.
And you can get it again and again. Adults, children, anybody, everywhere can get the same RSV infection over and over again. Our bodies just, for whatever reason, do not mount a good enough immune response to prevent it.
Yeah. Wow. Thank you for speaking to that. And we received a question from our audience. This one might be a little bit specific, so I'll see how you want to navigate it. But this attendee said that their 19-month-old has been congested since starting daycare in September. She also had hand, foot, and mouth, 2 ear infections in the same month. And the antibiotics seemed to help her congestion, but then it all came back when the antibiotics ended. And then she developed a cough for a month, which she was convinced was a postnasal drip. And then an allergist wondered maybe she has asthma since the cough has subsided. But does that sound kind of like just a virus working itself, or what would be your advice there, I guess?
I would say you should have either an infectious disease specialist or have your pediatrician make sure that they're reviewing everything that has happened so that they're able to answer your specific question because it's a little more in depth in figuring out exactly what stage you're at and what might be going on. I know I'm a parent, and with my kids, it really can seem like one continuous illness that never ends. But then I put my doctor hat on and I'm like, oh no, that's not true.
Yeah.
Technically, they were better for that one day. And they were up and playing and eating and drinking and doing all the things they need to do. And it was the next day that they were sick again.
Picked it up again.
So I know that there are actually different illnesses, but that's just the name of the game, is that they can get one illness after another. And that's just how it goes.
Yes. And 'tis the season, and children in daycare love to share everything, including their germs. So we're in flu season now, correct?
Yes.
And tell us, are there other seasonal infectious, illnesses that we need to be aware of?
Yeah, so we spoke about RSV and how that's a little bit different down here in Florida. Influenza is very important to understand its seasonality, and that it's wintertime is the time to get the flu. Flu is going rampant right now. Because unfortunately our vaccine rate and uptake rate for this season hasn't been that great. So I really urge everybody out there, if you're eligible to receive the flu vaccine, please do. It's not just for you, it's also for your child, that you're protecting them from passing on the virus to them. Other viruses that kind of have a seasonality to them is like para-influenza. So it kind of sounds like flu, right? And then also rhinovirus has a seasonality to it, where it's early fall. We're kind of stepping away from those viruses and entering the winter viruses now. The winter viruses are a lot of fun because during the winter time, we all gather together with family and friends. And we, as we're in closed spaces, is when we share these lovely viruses.
That's right. And you know what? I think I would take the cold stuff over any stomach bug kind of virus any day. So I'm like, Lord, please just keep us from any stomach bugs this season. That would just be no fun. To be sick at all is no fun. Everybody knows that.
I agree with you for sure.
Okay, what about, how do we treat these common ones? And you've spoken a little bit to, I know, vaccine for flu and others, but are there antibiotics for common cold? I sure wish there were. I think I know the answer to that, but
I
tell
know,
us
I
more.
wish there was too, but unfortunately, no, we do not use antibiotics for viruses. So when I said those two buckets, it was for that purpose, that if it's a bacterial infection, then we use antibiotics for it. So yes, there are rare cases where you start with the virus and end with the bacteria. And so we treat those bacterial infections with antibiotics. There are some viruses that have treatment though. So flu, the influenza virus, we do have therapies for. And it goes down to children that are 2 months old can receive medication to help reduce the symptoms and severity of having the flu. Outside of that, there's not a whole lot of other viruses that we have therapies for your everyday, otherwise healthy child.
Right. Good and helpful. Okay, what about respiratory infections in children? Are they always contagious, and how are they spread?
Yes, so they are always contagious. And the sneaky thing about them is that they're usually contagious, the most contagious, before they even show symptoms. So before you see the rash, before you see the runny nose, before the cough comes on, they're already contagious. They're already replicating very rapidly. And those signs and symptoms that we're seeing is the body responding to the virus reaching a certain peak of making copies of itself. And so we're already kind of late in the game when we see cough, cold, runny nose, because that's when it's super contagious. As far as prevention in those regards, I will give this tip, that oftentimes we love to like spray something on something our child touched and we'll wipe it off real quickly. And unfortunately, that's not quite how these disinfectants work. Make sure that you read those instructions, because a lot of the instructions, depending on which chemical you're using, may have a recommended time that the chemical sits on the surface before wiping it off. So I know I love to spray and wipe and we're done, but then I put the doctor, oh, that's good. I'm a dad and a doctor at the same time, a hat on, and I say, okay, wait, I get spray it, I know the product that I use, I have to wait a minute or two. I wait the minute or two and I come back to it and wipe it off. And I know that that gets that 99.9% killing that I really want it to have, so that I reduce how much of these viruses sit there. All of the viruses that we've mentioned today are non-envelope viruses, meaning that they don't require a housing around them to survive. Some viruses do.
Right. Okay.
And if you do anything to disrupt that housing for those viruses, you kill them very easily. For these viruses, however, because they don't require a housing, they can just kind of chill, and they're resistant to a lot of things like high temperatures, low temperatures, a lot of disinfectants.
Wow.
So it takes that time to kill them, along with the mechanics of what you're doing and wiping them off.
It makes me think about what's lurking on all of the kid things, you know. And such a good tip, man. I feel like any moms who are watching, I mean, this is me, but I'm like, spray, 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 wipe, spray, 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 wipe. I'm like, okay, I'm going to slow down now. This is a good tip. Thank you for that. This is like practical information that we can use to keep our families safe. Okay. So for example, the mom who, not me, not any other mom, because none of our kids are ever sick, but let's just say your kid is always sick with a cold. You addressed this a little bit, but as soon as they get over one, then they go to school or daycare and there's another one. So is that normal? And when should we be concerned about recurrent infections?
Yeah, it's a great question. So yes, it can be, it's normal for your kid to get recurrent infections, especially when they're in daycare or school and they're out there touching everything and then putting it in their mouths, or when they're not washing their hands before they eat. When do you get concerned and need to seek medical attention to, hey, something's not right? One is when it is one illness that has really been going on for too long. What does too long mean? Too long is when it's going on more than 7 to 10 days and they just don't seem to be getting better. The other thing is if they seem to be getting worse, and worse really means like the fever is going higher and higher and higher. They're getting more sleepy. First they were eating okay, now they're not even eating. Those are signs to seek medical attention, either to address the illness that they have, or it may trigger the doctor to do some more workup to see, hey, something's not right. Why are you this sick with the common cold when you really shouldn't be?
Yeah. Okay. That's helpful. Okay. Circling back a little bit, one mom wants to know if you're willing to share, what product do you like to use to disinfect toys? Do you have
that's a great question.
Inquiring minds want to know.
Let me think of what's on my counter right now. So I mean, I love a Clorox spray. No, I have there's no conflict of interest in any of the products that
Clorox does not sponsor this.
Yes, there is no ties between us, but I can tell you that a lot of the everyday sprays are made equally, despite what they say. So Lysol, Clorox, all of those sprays are made remarkably well. You just have to be mindful of the instructions, because they all are a little bit different in how long they need to stay on the surface before you wipe them off. That's a major difference between some of them.
Right. So you're good with Clorox on baby things if you wipe it off real good and it's off, right?
Yeah, that's fine. That's fine. I mean, you don't need to go to medical grade chlorhexidine wipes. You don't do that, please. They'll destroy all your things and can be dangerous to you and your child.
Well, I remember during the height of COVID days, my mom was like here helping me with the children one day, and she had her own little bottle of Clorox wipes, and she's just, and she wiped my kid's hands, and I'm like, don't wipe my kid with a Clorox wipe. What are you doing?
Yeah, no, it's not meant for skin surfaces. It's meant for those durable surfaces. Use the alcohol sanitizer. The hand sanitizer is better.
Yes,
or
exactly.
Just good old
Someone
soap and
asked
water.
about what about traditional? Yeah. What about the traditional alcohol spray for cleaning toys? You feel like that's a good thing too?
Yeah, that's fine.
Didn't know you were going to get into toy cleaning tonight, did you?
No, that's fine. No, I definitely feel you. My kids love to play with those toys and share toys with other kids. And I'm like, I don't remember this toy being yours. Oh, okay, it's somebody else's now. So yeah, cleaning it off with a regular wipe is fine, whether it's an alcohol wipe, a Clorox wipe, Lysol, There's lots and lots of different products. If you like the organic or sprays, that's fine too. The studies have all shown that they're pretty much equal, and that's fine as long as you follow the directions of how they're supposed to be used.
How it's used. That's great. Thank you, Dr. Tahani. Circling back on what we were speaking about, those recurrent infections, we received one question from our audience that this mom is pregnant with her second child due in December, and her toddler is in daycare and has been nonstop sick since starting. How worried should she be about the newborn being exposed?
No, so wait, to understand the newborn meaning the pregnant.
The newborn will come in December. Yes,
Okay,
December 20th, there'll be a newborn. Yeah, and then she's got a toddler in daycare.
Yes, so that definitely is a valid concern, and you want to make sure that while one of those illnesses are ongoing, as much as they're going to want to love on their new baby brother or sister, it's not safe. And so you should keep that distance that's there. And you can make it fun of how they blow kisses from far away, but I also understand in that age appropriateness, that in that age, they're very loving and want to be all over their sibling. And that can be tough. Good hand hygiene will be great. If you can convince them maybe to wear a mask, and then they can be a little bit closer, that might help mitigate some of those things as well. But depending on how worried you are with how ill they are, the safest thing is to keep that distance.
Yeah, that's good. I had a baby about this time last year with 2 siblings, and our kind of go-to was like, okay, he loves it when you tickle his toes. Can you touch his toes? Like, okay, just kind of keep them down there on that end. Great. Okay, we received another question from a mom who says her 8-month-old baby was diagnosed with ITP after she received a COVID vaccine, and she received her 2-month vaccines. She said, I'm worried about vaccinating even though she's back to normal levels. And what are the most dangerous respiratory viruses that she should be concerned about?
I see. The most dangerous respiratory viruses. Okay, so I mean, the influenza for children, influenza is the most dangerous respiratory virus that's out there, and that's why we vaccinate against it, because it really can cause severe disease of both their lungs and other organs too. Their heart can be infected, their kidneys, their brains. It really can be very severe. So that's why we focus a lot on influenza, the flu. Other than that, I mean, the other viruses can cause illness, but aren't nearly as severe. And when we also, as doctors talk about severity and danger, we talk about mortality, like what can kill you. And we know that influenza, the flu, can kill you. We know that COVID can kill you. So that's why we talk about those the most. The other viruses are there. They can cause illness, but not to that degree.
Yeah. Thank you for addressing that. You spoke a little to this, but maybe you could just remind us these good tips of how we keep our children from getting respiratory infections. And we said distance and keeping our hands washed. Any other tips?
Yeah. So I would say if you have a young child, I know when my daughter went to daycare in early schooling, she had a blanket that she went to school with. And I made sure that anytime that she brought that blanket home, that it was washed immediately. It did not pass my doorway until it went into a baggie, and then baggie to the laundry room, and in the laundry room it got washed with bleach. It's just a bomb of viruses and bacteria for sure. So anything that anything that's shared, also you want to be careful of. So if you have multiple kids in the home and it's possible for you to do this, not having them share towels or linens is really great, especially when they're sick, because that is the vehicle that we see commonly that will share respiratory illnesses. Equally, if you know that, hey, I'm doing my best and they get sick, that's okay. Also understanding that kids get sick, and you can make sure that they get good fluids, that they're eating enough, and more so drinking enough, and they'll get through it, and their immune system will be better for it.
Yes. Oh, it's good. Good advice. I forget, I don't think about the blankets and things, the kids sharing those, when they're sick. I think about don't touch his cup, don't drink after him, don't, use the same fork. But blankets, that's a good thing. I don't kind of put them on the couch together and let them share a blanket, but that's a good tip.
Yeah, my
Um,
kids now, they like to, they ask for them to bring a water bottle. And I'm terrified about it because they bring this water bottle to school and I don't know, I
yeah,
have no control whether they share
yeah,
it, whether they put
that's
it
true.
down, so it gets sanitized when it gets home too.
That's right.
Equally
That's
the same.
good. That's good. At what point should we seek medical care when our child has a respiratory infection? They're green nose, but how do I know it's just green nose? Let it be, or we need to go to the doctor.
Yeah, the green nose, you can let it be. That's
Okay.
okay. I'm more concerned about when they're not breathing right. So
Mm,
if they're breathing really fast, if they're not breathing, if they are looking like they're laboring to breathe. So what do we look for? You look in the little divot here in their neck and you see it pulling in, that's a bad
mm.
sign. And you need to go seek
Okay.
emergency medical care at that point.
Okay. Okay.
You may see nasal flaring. So when your nostrils kind of go out like that, that's a sign of respiratory distress. And you should also seek medical care at that point. That's really all signs that that virus has moved on from its upper household and is starting to affect the
Hey.
lower airway. And you need to do more for it, more support for it than monitoring them at home. The green nose, that's fine. I don't care what color comes out of their nose, frankly. And it's actually well documented that they'll start with something clear, and then parents freak out when it turns green or it turns yellow. Um, and that's actually a good sign because what we understand is from testing it that that's the introduction of white blood cells, the cells that fight infection, into this
Oh,
area of your
wow.
body. And so that's what makes that color, depending
Wow.
on what those white blood cells
Wow.
are releasing and what constitutes the different types of white blood cells that are there will make the color that is there. So it's actually a good sign. It usually comes around
Dr.
day,
Tatani, you're teaching us so much tonight.
it comes around
I'm
day
going to whip that
4 to
out at like a
7.
dinner party. It's going to be a fun fact that I
A fun
learned.
fact. It's not actually pus. I've had
Yeah.
parents ask me this, like, oh, is this pus coming out of their nose? No, I've seen pus come out of kids' nose. Yes, that is going to be white, curdly, something like you've never dreamed of. I promise you, you would never have dreamed something looking like
I
that.
hope I never have to deal with that.
Yeah, no, it will smell foul and you'll smell it from across the room and it's
Ooh,
awful. So that would be a sign to go get your child evaluated. Certainly, if you have an older child that's able to tell you things that hurt, and they say
yeah.
like here where their sinuses should be. So you have your two big
Right.
sinuses here, and then two big sinuses here. Those are the most common sinuses to get infected.
Yeah.
Um, Another lesson for that is that not these develop over time. So not all children have those sinuses there. So if you have a young child, less than 2, you're not going to have all of that
Have all that
present
yet.
for those to get infected, right? So I don't worry so much about sinus infections, but they're less than 2. Older
Okay.
than 2, you can have pretty severe bacterial sinus
Mhm.
infections that require antibiotics. They may have pain there. They may have tenderness if it's touched there. It may feel really warm there compared to the rest of their face. All signs
Oh,
that you might have a distinct sinus infection that requires more than just symptomatic care, Tylenol and fluids.
okay. This is good. I'm going to deviate from respiratory for a second because we've gotten some questions about it, and I have a dog in this fight too about the ear infections. So,
Mm.
does the runny nose, does the common cold stuff, does that cause ear infection, or is ear infection simply bacterial from water in the ear, or what's kind of
No, it's a
the
great,
cause of
a
this?
great question. A great question, and we probably could have a whole webinar on ear infections.
Let's do it. We're having you
So
back.
first, I'm just going to orient you a little bit in that the tubes that connect to the inner ear, we actually have our gestation tubes that connect from the back of our throat up into the back of our ears. So yes, there can be a connection that if you have sinus infection or upper respiratory infection and it's leaking into the back of your throat, that then it goes and reflux back up into your middle ear. Those viruses also cause those tubes that are supposed to allow for fluid to drain out from your middle ear to swell up and close and not let fluid move. The biggest life lesson from the body is that if fluid's not moving, it can get infected.
Yeah. Okay.
So with that fluid that's not coming out of the ear, it can get infected. And that's when you can have a bacterial infection on top of the viral infection that they had. And it is pretty common that kids will initially have a viral infection and then start spiking higher fevers than what they started with. We look in their ears, we see fluid, we see pus, we see redness. And that's when we know that they have an ear infection. It does take a doctor to diagnose an ear infection. They have to look inside your child's ear and look for the specific signs of whether or not it's there.
That's good. Thank you. I feel like I should be an expert in this with the amount of ear infections that we've had, but I still don't understand, but you're helping me and I appreciate that. And I know several of our moms asked that as well. Okay, let's talk treatments because we're getting some questions about that too. Are there any immune boosters like toddler immune boosters that you recommend or probiotics, anything like that you would suggest?
So I would say there's been a lot of research in this field of what you could give to help a child overcome some of these infections. Nothing is really conclusive, to be honest. So there have been studies on the vitamin C, giving them the probiotics, and it's all kind of in the wash right now, to where I can't tell you with 100% confidence of what's going to work for your child. So I leave that to moms to research and see what they feel works with how their child works. Be safe about it though. So if you have a question about a specific product, you can always ask your pediatrician about it. I would be very wary of non-brand or off-brand probiotics that aren't regulated, just because you don't know what's in it. And you want to be careful that it's not a live bacteria that you're giving your child that could infect them, actually cause, and we have record of children getting infected from probiotic products. Vitamin C, all of these things also, I urge moms to use them like they use drugs, like their medications, right? So they all have side effects. And so even vitamin C is a drug and can have side effects that you have to be wary of, where it can cause stones in the kidneys. And so you have to be careful of giving those high doses of vitamin C. It's fine using the supplementation, like the amount of vitamin C that should be in their regular diet, but giving the high doses of vitamin C can be dangerous.
Can be dangerous. Okay, wow, it's good to know. Sometimes you just think, oh, vitamins are safe because they're vitamins, but no, in the right proportions. This is good. Okay, I have a list for you. I'm going to go down. We're going to kind of like lightning round, okay?
All right.
About treatments. So what are your thoughts on Vicks Vapor Rub?
So Vicks Vapor Rub is okay in the right age group. And that's going to be a common theme through all of these. The smaller the airway, stay away from Vicks Vapor Rub, because it can be irritating and can close off the airway. And if you close off the airway, you don't breathe. So be very careful with young infants that have small airways. Older kids, it might actually make them sleep a little bit better, open up their airway, make them feel a little bit more comfortable when they breathe at night. Okay,
great. Humidifiers.
Humidifiers are really safe, as long as you keep it clean. So I always have a devil's advocate here that you have to make sure you keep it clean. There are records out there that show of children getting infected with Pseudomonas, a really bad bacteria that likes water and humidity.
Wow.
So you have to make sure that you clean it. If you get one that can go in the dishwasher, that's fantastic. If you get one that you just wipe out with Clorox and you can get into those crevices, that's fine. But yeah, no, as a therapy, it's fantastic. It really keeps everything moist and allows children to breathe a little bit easier when things are kind of congested.
Okay. Nasal suction bulbs. These make me terrified. I know they shouldn't, but they make me a little bit terrified.
They scare me
Maybe they
too.
should.
They
Okay. You're
terrify.
you're an infectious disease doctor. That makes me feel good.
I honestly don't like them after you get discharged from the hospital.
Okay.
They're great in the hospital. We use them as life-saving measures in the
Okay.
hospital for little babies. But after that, there are a lot of other tools that you can use to help get that junk out. And those bulbs are huge. Actually, the origin of those bulbs are not meant for the nose. They're meant for the mouth. They're meant to
Okay.
get fluid that like amniotic fluid when a baby's
Right.
born, so
Right.
that they can breathe. You got to suction it out really quickly. Um, Outside of that, it's a huge tip that's not meant for the nose, really.
Right. I just think this doesn't make sense. And I'm always like, ooh, I can't do it. So good to know. I'll just turn on the clean humidifier instead. How about that?
Yes.
What about nasal wash or sprays?
So nasal wash and sprays, some of them are really good, and some of them are formulated for like little babies.
Okay.
It's great because you spray it up there, and you don't have to be too timid about it. Like, you can give it a little force to jettison it up there, wash things out, and get it clean. The thing that you have to be careful about and make sure you pay attention to all of your labels, that there's no medications in there. There's some
Okay.
dangerous medicines out there that you don't want to give your child. So
Mhm.
I'm fine with the salt ones, the
Okay.
ocean
Like a
spray,
saline. Okay.
the saline. That's all fine. Just make sure it's not the medicated type. If there's a word out there that you don't recognize, I wouldn't give your child it.
And those make me equally as squirmy as the bulbs. And that, I mean, you're just like squirting it up there in the baby's nose, like just and let it be. It's going to come out
It's
where it
going to
needs to come
find its
out.
way out. It's going to thin out. The idea is that it thins out the mucus that's there.
Right?
And if it has the salt component, salt is very drying. It helps dry out some of the
Love that.
really wet mucus that's up there.
Okay. I'm feeling more confident about it, but I still don't know if I could do it. No, I'm teasing. Okay, talk to us about Benadryl. What are your thoughts on Benadryl?
So Benadryl is a real over-the-counter medicine and can be very dangerous. Can cause liver failure. Can
Mm,
cause children to stop breathing if it's
wow.
given in high enough dose. So you want to be very careful of what you're using it for. Benadryl is great for allergic reactions, and it's great in some cases to help with sleep. Outside of that, it's not really meant to help with viral infections. The drainage that you're getting from a viral infection is very different than the drainage you may have from allergies, from like seasonal allergies. Like the pollen comes out I don't know about you, but as soon as the weather changed, my nose
Yep.
is like, ah. So that I might use Benadryl for to help dry me up and then go to sleep. And same with a child,
Okay.
you can use it in that case. But for a viral infection, I edge on the edge of caution that it may not necessarily help you.
Okay. Question on that note. All that I've learned about the mucus from the nose tonight. And when you say that it's clear, so in like a seasonal allergy versus respiratory infection or something, or like a common cold, would seasonal allergies only be clear, or do your white blood cells try to like attack that too? And could you get green with just seasonal allergies?
Yeah, you can get green too. There's no way to differentiate. And there's no way a doctor can differentiate either. They have to take the situation and
Okay.
how the child's doing. A good differentiation though is fever. Like
Yeah. Okay.
you're gonna have fever with a common cold. You should
Yeah.
not have fever with a seasonal allergy.
Okay, this is so good. Have always had the common misconception that clear, it's nothing, you're fine, but green is something else, But now I know why it's green, that's my nugget that I'm leaving with tonight. So thank you for that. Okay, what about tea and honey? I think you're an advocate for tea and honey, but for children,
So for children, it's okay. It just depends on the age.
okay,
So your young infants, honey is not recommended. And that goes back to something called botulism that we learned about, the toxin can exist in honey. And for young children, they can be particularly susceptible
mhm,
to that toxin that's in honey. So you don't want to do that. But older kids, your toddlers and up, when they have a cough and you want to ease their throat, a spoonful of honey tastes amazing, and it can help. It actually does have some like antitussive, so anti-cough properties to it.
That's awesome. So great. And I'm very much an advocate for hot tea and honey as an adult. It just is so soothing, even
Yeah.
if you
Oh,
just
I
had a
would
long
add to
day.
that though with tea. Be careful what kind of tea.
Okay.
Pay attention to what tea. I mean, a non-caffeinated herbal tea is fine. A citrus tea is fine.
Okay.
But be wary of some of the more potent things out of there. I just remember the call from my mom when I was on Mommy Pager once, and she mixed up the teas and gave her slimming tea to instead of the nighttime chamomile tea to her child. And then she was calling me asking, what do I do? Because he now has the slimming tea. So there can be side effects from a lot of those other teas in kids, so be careful.
Good to know. Keep it safe with those herbal teas. That's good. Okay, finally, cough medicines. Let's talk about this, because sometimes with my husband, he's like, "Oh, give him a little Mucinex," and I'm like, "I don't know if I can do that with my kids. I don't think so. I don't think we can do that." So talk to me about Robitussin, Mucinex, Dimetapp, and others.
Yeah. So the general statement is you want to stay away from a lot of those anti-cough medicines in children. They have tons of side effects that can happen, and they don't really work all that well most of the time. You kind of want your kid to cough up and bring up the junk that's dripping down into their chest so that they don't get a chest cold, and it just stays as an upper respiratory infection. At the same time, if you want to ease them, then that's why I bring up the honey. Yeah, a lot of those things, they can make your child just sleepy, and then they can have really bad effects on the liver. So you want to be very careful of what age you're giving those to. And the easiest way to sort all the bevy of medications that are out there is to ask your pediatrician, what do you recommend as far as this goes as an anti-cough medicine? And they'll assess your child, what kind of medicines they're okay with taking, how old they are, how much they weigh, and depending on those factors, they'll say, okay, this one is probably safe for you to take.
That's great. Thank you for that. Let's see. I think we have an audience question here. Okay, what about when a child, this attendee said, my grandmother always says when the toddler's coughing that you need to tap the back and help them get it out. Kind of like, is that helpful? Is that just kind of a myth?
I would not help them get it out. I mean, if they're choking, yes, you can you can get CPR trained and know how to do back blows to help them like expel whatever they're choking on. But if they're not choking, you might freak them out more than when they're coughing. Yeah. Be gentle, soothe them, and they'll be okay.
That's great. That's great. Dr. Chitani, with COVID, we've noticed, fewer colds and flu infections because people were wearing a lot of masks. Now people are seem to getting more comfortable, but also more colds, more respiratory infections because masking isn't as widespread. Should we be having our children wear masks, or do they need to get sick? Does this build their immune system? Kind of what's your 2 cents on that?
So my 2 cents, one, if you can vaccinate your child against it, you should vaccinate them against it. 2, we are still encouraging masks. It's still highly encouraged, even if your child is vaccinated, just because we need that herd immunity to develop in the community to prevent those most serious viruses that we've been talking about. The common cold stuff, yeah, that's fine. I'm not trying to prevent that with a mask, quite honestly. I'm more concerned about those very dangerous viruses that we've talked about today.
Yeah. Thank you so much for your time. This is fascinating. Whenever I think, man, we we kind of all know this topic. I'm just blown away at how much we just don't know, and how much you truly are the expert. So just thank you, Dr. Chitani. If there are any last minute questions here, I want to respect Dr. Chitani's time. He has a family and he's a very busy doctor as well. And so thankful for those of you who've joined us tonight. I hope that you have been as encouraged as I have been with the great information that we have been given. But if you have any last minute questions, you can throw those in the Q&A and I will try to get those right here in front of him. But while I give everyone just a couple more minutes, I want to go ahead and draw everyone's attention to Thursday, December 9th. So mark your calendars. I believe that's 3 weeks from tonight is going to be our next episode. And the topic is going to be connecting with your child through playtime. So playtime can be a perfect time to connect with your child and a great way to help them develop. We're going to be talking about how to learn how to set up a playtime, the best toys based on your child's development, so you can promote positive attention skills, bring out the best in both you and your child. We all want that. We're also going to have some exciting things. I think we might have a giveaway next time and some great ideas for Christmas gifts. So we're going to help you finish off that Christmas list for your kiddos. So make plans to join us on Thursday, December 9th, and we'll send you an email with all the details. And again, if this was your first time joining us, thank you. And if you've joined us before, we're just so glad that you're back. All of these can be accessed at jacksonevents.org. So you can go there. And if this was something you want to share with maybe a spouse or a friend, give us about a week and we'll get that up on the website, and then you can send it over and share it. But Dr. Chitani, thank you again. It's always a delight to have you.
Yeah.
So thankful. We're receiving comments saying, no questions, just wanted to say this was great. And the doctor was so helpful and informative. So thank you for spending time with us tonight. And thank you again to Jackson for hosting. And hope everyone just has a wonderful weekend. Here's some links to great resources if you want some further study on tonight's topic. But without any further ado, I will say happy almost weekend, and everyone enjoy your wonderful Thanksgiving holiday with your families. And thank you again, Dr. Chitani.
Thank you, Sierra.
Take care.